Now, if I transfer over here to the skeleton, so we can point out some of those same structures and some additional structures or different additional terminology. So on this individual coxal bone, then all this large flared portion that I'm covering up pretty much with my hand is the ilium. And then this portion anteriorly that I've just wrapped my fingers around, or that I'm running my fingers along, is the pubis. And then this portion of the coxal bone back here that I have my hands around is the ischium. So the three areas are ilium, the pubis, and the ischium. Again, you see this large obturator foramen. You can also see the acetabulum, or what part of it is visible. You can see how that head of that femur articulates into that acetabulum to create a ball and socket type of joint, which is what your hip happens to be. At the superior aspects of the ilium, this ridge running all along the superior surface is the iliac crest. You can feel the entire length of the iliac crest on yourself, and if you're doing so on yourself and bring your fingers forward along the iliac crest as far as you can go, then especially if you're laying down flat on your back, there's a rather large prominent bump that's going to extend forwards. Right where I've got my finger, this is the anterior superior iliac spine. Come back here posteriorly along the iliac crest. If I turn the skeleton around a little bit, then this point here would be the posterior superior iliac spine. As we come down into the inferior aspects of the ilium, then the large indentation here again is the greater sciatic notch. And then into the ischium, this projection here is the ischial tuberosity, the ischial spine, and then extending down into the ischium, the rounded curvature here being the ischial tuberosity, Now then, notice how the coxal bone articulates with the axial skeleton. It is the ilium portion of the coxal bone that articulates with the sacrum of the vertebral column to form, as the classic term we constantly hear, the sacroiliac joint. So all this in here would be a sacroiliac joint. But then notice how anteriorly the coxal bones articulate with each other as the two pubic regions of each coxal bone articulating. And you'll notice that on this skeletal preparation here that there's a pad of plastic, I believe it is here, or a little piece of rubber within the skeleton to mimic that in life this is a pad of cartilage that would be in here. This pad of cartilage is the pubic symphysis, which is the joint that is created as the two pubic bones articulate with each other anteriorly. Both the pubic symphysis and the sacroiliac joint are joints that have just a little bit of movement, and that movement is really manifesting during childbirth, because during childbirth obviously it has to pass down through the birth canal, so therefore the two coxal bones have to flare apart from each other. So it's going to have to be a little bit of movement here in the sacroiliac joint, as well as a spreading apart here at the pubic symphysis. Now, some additional miscellaneous terminology that is important, especially in obstetrical applications, is that when you have the two coxal bones articulating here as a pubic symphysis anteriorly and onto the sacrum posteriorly, then we are creating literally the pelvis. And we've actually got two pelvic regions, or two regions to the pelvis. This area of the pelvis, where I'm moving my hands around, that is between the two ilium portions of the coxal bone and the sacrum and the lower lumbar vertebra, is referred to as the greater pelvis, also known as the false pelvis. And then if we extend down into this recess, where I just put my fist down into, then what we're into now is surrounded by the pubic bone anteriorly and the ischiums posteriorly, and we're into the lesser pelvis, also known as the true pelvis. And the divider between this false pelvis and the true pelvis is going to be this pelvic brim that I'm running my fingers around. So this is going to be the pelvic brim. Now, if you pass your hand from the greater pelvis into the lesser pelvis, in other words, from the false to the true pelvis, you are passing through the pelvic inlet. And then if I extend my hand all the way through so it is coming out the posterior side, it is now coming out the pelvic outlet. So this opening here would be the pelvic outlet then. And of course, obviously, the pelvic inlet and outlet together is going to comprise a portion of the birth canal. Important consideration in obstetrics. So this concludes the pelvic girdle consisting of the two innominate bones. Thank you.